Hello and good afternoon friends, welcome to the CEC-UGC live lecture. Dear friends, we would like to tell you all that today in this session we are going to talk about vector-borne diseases. We are specifically going to talk about dengue and chikungunya viruses. We are going to discuss the history behind the dengue and chikungunya viruses, as well as we are going to throw light on mode of transmission, that how the diseases are transmitted with the help of these two viruses, as well as the symptoms behind the diseases, as well as what are the prevention measures. And for this we have again with us in our studios Dr. Amit Bhattacharya. Dr. Amit Bhattacharya is Assistant Professor in Department of Zoology, Ramjas College, University of Delhi. So dear friends, without wasting time, we would like to take this lecture forward and would be discussing on vector-borne diseases, that is specifically on dengue and chikungunya viruses. So first of all, I would like to welcome our guest, Dr. Amit Bhattacharya.
Thank you, ma'am. Thank you. Thank you very much, ma'am. Today I will be covering upon the two major diseases which is widespread during the monsoon season, especially during the monsoon season. The first disease is the dengue and the second one is the chikungunya. And as the name suggests, both of them are the vector-borne diseases, or we can specifically call them as the mosquito-borne diseases. Before going into these diseases, the history and the prevention and how they are transmitted, let me cover up what exactly do we mean by vector-borne diseases. So vectors are nothing but the small living organisms that carry serious diseases, which can be in the form of the viruses. So the most common vectors found are the mosquitoes, sandflies and ticks. So the mosquitoes are the best known disease vectors in this category. Now, vector-borne diseases is not new to this world. There are about number of vector-borne diseases which have spread throughout the world, and about 17% of all the infectious diseases which are spread throughout the world are because of vector-borne diseases, and more than 1 million deaths occur annually because of these vector-borne diseases, and over 100 countries are at risk of contracting dengue alone. So there are a number of vector-borne diseases which are there, and in today's lecture we will cover up the dengue and the chikungunya vector-borne diseases. So majorly the vector-borne diseases are found, the various vector-borne diseases are found, which consist of malaria, filariasis, dengue, chikungunya, Japanese encephalitis, leishmania. So today we will cover up the dengue and the chikungunya. In the subsequent lecture we will take up the other vector-borne diseases. So the main vectors and the diseases which they transmit are, as I told you, the main vectors are mosquitoes. So under this mosquito there are different types. The first one is the Aedes mosquito, and if we see the picture of the Aedes mosquito, we can see the characteristic white bands on their legs. So these Aedes mosquito transmits dengue fever, yellow fever and chikungunya, while the Anopheles mosquito transmits the malaria disease. While in the case of Culex, the Japanese encephalitis, lymphatic filariasis and West Nile fever are transmitted. The other vectors consist of the sandflies, which transmits the leishmaniasis, sandfly fever. Then comes the tick, which causes the relapsing fever, tick-borne encephalitis, etc. Then comes the bugs, which causes the Chagas disease, or which is commonly called as the American trypanosomiasis. Then there are tsetse fly, which causes the sleeping sickness, which are called as the African trichomoniasis, and finally the fleas, which causes the plague. So all these vectors are very important and they transmit various kind of diseases. Now if we see what are the factors which are contributing for the spread of these diseases and why do these vectors grow so rapidly. So there are a number of interrelated factors, of which consist of the poverty is one of them. Then there is deforestation, water storage and irrigation. So there is lots of stagnant water which occurs. Then there is exponential growth of human population. Then there is climate change, international travel and commerce and travel, due to which there is exportation of these diseases to the other part of the world with the help of the tourists or through the cargoes in which these mosquitoes or other vectors travel. So there are a number of these kind of factors which are interrelated to each other, and each of them help in spreading of this disease. Now, the government of India has got a website which comes under the Ministry of Health and Family Welfare, under which the National Vector Borne Disease Control Program is mentioned. So, under this website, we can get all the details of all the vector-borne diseases which is widespread in India. What are the prevention measures, what are the symptoms, when the patient gets disease, what are the symptoms, where should the patient go, what are the medical centers where the appropriate treatment and diagnosis are available, what are the diagnosis kits which are available in the market, and subsequently what are the medical centers where the patient can go and report, and subsequently all the treatments can be done in those particular centers. So, the government of India has got this website, so we can log into this website and check what are the vector-borne diseases which is widespread, and what are the statistics, and which diseases gets widespread at which part of the season. So, this gives an overall idea about all the transmission and the symptoms and other factors. Now, in the vector-borne diseases, let's come into the first disease, which is the dengue. So, dengue is a rapidly spreading mosquito-borne disease, which is in which the mosquito is Aedes aegypti. So, Aedes aegypti is the main vector for dengue, which generally bites during the daytime only, while the secondary vector in the dengue case is called as Aedes albopictus. So, these two vectors are the most important and crucial one which transmit the dengue virus from one person to the other person. Now, the dengue, there are 4 closely related serotypes of these viruses which are present. So, in dengue, there are 4 different types of dengue viruses which exist. Now, it has been found that 1/3 of world's population is at a risk of this infection, and as many as 400 million people are infected yearly because of dengue. So, dengue is one of the most emerging and widespread problem which has occurred throughout the world, and this dengue virus has developed drastically during the 1950s. So, the first case of these dengue viruses were reported in the 1950s in Philippines and Thailand, and subsequently it got spread out to the various parts of the world. Now, as I told you, the dengue virus is divided into 3 different classes: Den1, Den2, Den3 and Den4. So, there are 4 serotypes of dengue virus which are available, and they have said to be originated from monkey. So, they independently jumped into humans in the African region or South Asian regions between 100 to 800 years ago. So, the dengue hemorrhagic fever was first documented in early 1950s during endemics in Philippines and Thailand. So, dengue virus after that time has emerged like one of the major diseases throughout the world. And if we see the picture over here, we can clearly see the dengue virus particles which are round, spherical in structure and darkly stained. So, this is a tissue section specimen in which we can see the black dots, spherical black dots at the center. So, those are nothing but the dengue virus particles which are present within those cells. Now, the dengue virus, if we see the structure of the dengue virus is a spherical virus which comes under the genus Flavivirus, and the family is Flaviviridae. So, these dengue viruses have got multiple copies of 3 structural proteins, and a host-derived membrane bilayer is present, and a copy of positive sense single-stranded RNA is present inside them. And the 3 major structural proteins which are present in these dengue viruses encodes for the capsid, the precursor of the membranes, and the envelope protein. Along with these structural protein, there are 7 non-structural proteins are also present inside this virus. So, if we see the spread out of these dengue serotypes throughout the world, we can see that dengue is spread mainly in the Indian subcontinent, in the South Asian region, some parts of the Australia also, then some parts of the Africa is being affected by this dengue virus, and the South America or the Latin American part is also affected. And if we see the color code, this shows the presence of the various serotypes. As I told you, there are 4 dengue serotypes viruses which are present. So these 4 serotypes are spread out throughout the world. And if we see, the most prevalent one is the 4th serotype, which is called as the DEN4 serotype dengue virus. So in India, mostly the 4th serotype DEN1 virus is found throughout the Indian subcontinent. Now, what is the mode of transmission of these dengue viruses? So it has been said that the dengue viruses is spread through the mosquito, which is called as the Aedes aegypti. So if we see the mosquito picture, we can clearly see that there are white stripes present on the legs of this mosquito. So that's a characteristic or identifying feature of this particular mosquito. And this Aedes aegypti is the primary vector of dengue viruses. So the virus is transmitted to the human through the bites of these infected female mosquitoes. After the virus incubates for 4 to 8 days, an infected mosquito is capable of transmitting the virus for the rest of its life. So we can just understand how these viruses are being spread out with the help of these mosquitoes from one person to the other person. So this is becoming very tedious task to stop or control these mosquito population. Now, the major dengue transmission vectors, as I told you, are the first one is the Aedes aegypti, which we just discussed. So the Aedes aegypti is a mosquito which is generally found in the tropical and the subtropical regions of the world, while the other vector is called as the Aedes albopictus. In this albopictus, these are said to be generally originated in the Asian region. So we can see the images of both these vectors, dengue vectors, which are present shown over here. Now, if we come to the life cycle of these mosquitoes, the Aedes aegypti, it has got a very complex kind of life cycle. So the life cycle is covered into 2 phases. One phase is completed in the aquatic medium, while the other one is completed in the terrestrial medium. So there are 2 phases in which the life cycle is completed, and as I told you, there is a complex life cycle which is present with a dramatic changes in the shape, function and its habit. So as the eggs are laid, there are if you can see the picture, there are very small eggs which have been laid at the surface. So these eggs then move into the aquatic medium where the larvae are formed, and these elongated larvae we can see in the image. These larvae subsequently go on to form the pupa stages. So the pupa are nothing but, if we see, it's a comma shaped structure which is present. And as the pupa develops, it subsequently develops into the adult form, which is formed in the terrestrial mode. So the life cycle, if we see, is completed in the terrestrial as well as the aquatic medium, and subsequently the adult again goes on to lay the egg. So the life cycle completes from the laying of the egg, which starts in the terrestrial medium, then subsequently it goes on to the formation of the larva, which takes place in the aquatic medium, then the pupa stage, which also takes place in the aquatic medium, and finally the adult is formed, which is a terrestrial mode of living. So it flies off, and as and when required, it lays down the egg to complete the cycle again. So if we see the bottles over here, how these life cycle has been replicated in the laboratory conditions. So if we see in a patch of paper, the eggs have been put into that bottle. Subsequently, the water medium was added to this bottle so that the larvals can be formed. So the larvae have been formed, which we can see elongated structure which are swinging along with the water, and then the larvae goes on to form the pupal stages, which are comma shaped in structure, and finally the adults are formed in the terrestrial environment. So the life cycle lasts for about 8 to 10 days at the room temperature. It all depends upon the level of feeding. Thus, there are two stages. First one is the aquatic stage, which covers up the larval and the pupae, and then there is a terrestrial phase which covers the eggs and the adult. So this is how the Aedes aegypti mosquitoes breeds and develops from its larval and the pupal stages. Now, if we see the distribution of the dengue and the countries which are affected by the dengue viruses, this is a picture released by the World Health Organization in the year 2013. So this shows that the dengue viruses are majorly spread out in the Indian subcontinent. Then we can see parts of the Southeast Asia which has been affected, some part of the Australia is also affected, some of the countries of the African regions have got affected, and some of the parts of the Latin America and Southern America which has got affected. So we can see that there is a January isotherm and there is a July isotherm. Between them, all the countries have got affected, and this is because most of these countries have got the optimum temperature and climate for the survival and development of these vectors, so that they can be transmitted from one host to the other host. So these countries specifically provide a optimum condition for the growth and development of these vectors, which is in the case of dengue, which is Aedes aegypti. So there is appropriate conditions which it requires, and subsequently during these seasons these develops very rapidly. So as the monsoon is coming, so these viruses will develop and will be frequently transmitted from one infected person to the other infected person, and a number of cases will be reported in the hospitals and the medical centers. Now, if we see the statistics, how the dengue cases have increased over the years. So, as I told you, the first case of the dengue came up in the 1950s as the epidemic in Philippines and Thailand. So, in the 1955-59 year, there were only 908 cases, and subsequently during the year 2000-2007, there were about 9,25,000 cases which have been reported throughout the world. And if we see the red color pick dots, this shows the number of countries in which the cases have increased. So initially there were only few countries in which the dengue cases were reported, and subsequently we can see more than 60 to 70 countries the dengue cases have been developed. And to the latest reports of the WHO, it has been said that about 100 countries throughout the world have got the affected with the dengue viruses. So we can just imagine how this virus is spreading throughout the world, and over a period of time, if we don't check these viruses, it may spread like anything. So if we see the dengue epidemicity in India, this is a graphical representation from the data collected in 2012 by the government of India. So we can see that the dengue cases have been reported throughout the Indian subcontinent and from the various states of India. But if we see, the major dengue cases are reported from the southern parts and some of the eastern parts of India. So these consist of the states like Tamil Nadu, Kerala, West Bengal. So if we see the next image over here, the dengue cases and deaths which has occurred in the year 2010 and 12, so we can see the maximum number of cases reported were from Tamil Nadu state, which was about 5,376 in the year 2012, and for the Kerala state it was 2,995 cases. Subsequently, for the West Bengal in the year 2012, 2,681 cases have been reported. For Karnataka, 2,403 cases have been reported, while in Gujarat there has been a dip of the cases. So if we see the statistics, we can see that there is gradual increase of these cases over the years of the time in some of the states, while in some of the states there have been decrease in the reports of these cases, and these decrease in the report cases must be because of the proper prevention and other facilities which are developing in various parts of our country. So all the health centers have been loaded with all the diagnostic kits and whatever major preventable measures which are available, and there have been a huge amount of advertisement of the prevention and what are the things we can do to prevent the dengue virus to be spread out or the chikungunya virus to be spread out in our locality. So all these mode of information have been provided by the government to the people of India. So if we see the pie chart over here, the spread out of the various cases of dengue, we can see that majorly the cases are from Odisha, then comes the state of Karnataka, then comes the Gujarat and Tamil Nadu. From Delhi also there are lots of cases have been reported in 2013. Then West Bengal is there, Maharashtra is there, Punjab is there. So we can see throughout the Indian subcontinent cases have been reported. So we can see that the dengue cases is a endemic in India. So throughout the Indian subcontinent from various states the cases have been reported, and we should take proper action and measures to control these disease from spreading out in a huge way. So if we see the dengue incidences in the America, in the year 1980-89, there were only few regions in which the dengue cases were reported. Like in the case of 1981 from Cuba, there was an outbreak of dengue. But if we see the picture or the spread out of the dengue virus in 2010, we can see that a number of states within the Americas have reported the dengue outbreak, like Honduras, Colombia, Venezuela, Brazil. So we can see how this virus is spreading throughout the world. So this virus is spreading, and proper prevention and other diagnostics measures should be taken up to prevent or check this virus at the correct moment. Now, before going into the various prevention measures, let's come into how exactly this virus goes into our body or transmitted through this vector Aedes aegypti, and how exactly it develops within our body and forms the various daughter cells. So as soon as the vector, mosquito vector, which is the Aedes aegypti, it injects with the help of its piercing type of mouth parts the blood into us, this blood contains the virus. So as I showed you, the virus is having a single strand, positive single stranded RNA. There are structural proteins present and there are non-structural proteins also present. So this single stranded RNA virus then gets injected into our bloodstream. So the bloodstream, it goes to the cells, and as these cells are having the receptors present on the top of it, these viruses get attached to these receptors, and through the help of these receptors they get engulfed into the cells. So the receptor mediated endocytosis start taking place, through which this virus is engulfed into the cells. Subsequently, these viruses start reproducing or replicating within these cellular cell forms. So what they do is they release their single-stranded RNA, which goes on to transcribe and translate, and subsequently goes on to form a number of daughter viruses, which then burst out from these cells to get transferred into the other cells. So this is the primary infection pathway of the dengue viruses, how these viruses spread and develop within our cells, and how they are then taken up by these mosquitoes again, and when these mosquitoes takes up these viruses from one of the infected patients, and it goes on to transmit to some other infected patient. Now, if we see how the immune system adjusts to the attack of dengue viruses or the dengue infection. So as soon as we have got a dengue infection, it is called as the primary dengue infection. So if we don't have any infection from dengue or any related flavivirus infections, it is called as the primary dengue infection. So as soon as the primary dengue infection start taking place, there is a increase of the NS1 protein. As soon as the NS1 protein start forming, there is a formation of IgM antibodies against these viruses, and subsequently IgG antibodies are formed after the onset of the symptoms. So we can see that in the primary dengue viruses, the immune system has also start acting upon the thing. Subsequently, after the treatment of the primary infection, if we again get a dengue infection through our lifespan, this becomes a secondary dengue infection. So again the virus gets infected, as we already had a dengue infection, so there will be presence of the memory IgG cells or the immunoglobulin cells which will be present in our blood circulation. So they will immediately recognize these viruses and they will start degrading or elute out them from our blood circulation. So the IgG level will increase as it will trigger the formation of new IgG, and subsequently there will be a formation of IgM also. So the NS1 protein is also formed in our body during this dengue virus infection. Now if we see what are the symptoms of these dengue viruses or the dengue disease. So the first major symptoms is the headache and the fever. Second comes is the bleeding of gums, nose and eyes. So the gums bleeds, there is blood profusing out from the nose and the eyes. Because there is decrease in the blood platelets level, so what happens that there is no coagulation which is occurring, due to which the blood coagulation doesn't occur and the bleeding start taking place, and subsequently there is a vasodilation, means the capillaries, blood capillaries becomes very thin, so there is a chance that these capillaries may burst out and there may be a bleeding which may be reported in that case. Subsequently in the skin there are rashes which develop, there are bruises which develop, then the patient reports of the joint pains, then there is altered hematopoiesis or the formation of the hematopoietic stem cells. Infrequent complication comprises of the acute pancreatitis, renal failure, splenic rupture, and subsequently the patient reports of low blood pressure, shock and other symptoms like vomiting, intestinal bleeding. So there are a number of symptoms which the patient start developing after the onset of this infection, and subsequently the patient goes into the different phases of these infection. Now the WHO has divided this dengue infection into three major categories. The first one is called as the undifferentiated fever, the second one is called as the dengue fever, and the third one is called as the dengue hemorrhagic fever. So all these categories are depending upon at which stage the symptoms have been treated or diagnosed. So the dengue hemorrhagic fever is further classified into 4 severe grades. So dengue hemorrhagic fever is the last stage of the dengue fever, which is the most acute and the lethal form of the dengue viruses. Now if we see the chart over here, the clinical presentation of the dengue virus infection is divided into 2 major phases. First the asymptomatic, the other one is the symptomatic. The symptomatic is further divided into undifferentiated fever or the viral syndrome and dengue fever syndrome, and the symptomatic is covered under the dengue hemorrhagic fever, which is also called as the plasma leakages which occurs during this period. The dengue fever syndrome is divided into 2 phases. First is called as without hemorrhage, the second one is called as with unusual hemorrhage. Dengue hemorrhagic fever is divided into 2 phases. One is called as no shock phase, the other one is called as the dengue shock syndrome. So the dengue virus fever is divided into various classes depending upon the symptoms of the patient. So there is, first one is the undifferentiated fever, the second comes is the dengue fever syndrome, and the third comes is the dengue hemorrhagic fever, which is the last stage of this one. Under the dengue hemorrhagic fever, the dengue shock syndrome also comes up. So what are the various symptoms which we find during these dengue cases? So there is nausea, vomiting, rashes which occur, then there is pain which occur, leukopenia occur. So these are the warning signs which occur, and subsequently the dengue patient, if not treated at the correct point, goes into the severe dengue hemorrhagic fever, where there is a severe plasma leakage, there is a severe hemorrhagic, and the patient may die off because of organ failure also. So it's very critical that this fever should be recognized and diagnosed at the very early stage, and all these methods of prevention should be started, and the patient should be treated with the available things. Now, the dengue hemorrhagic fever, as I told you, is further degraded into 4 severe phases: phase 1, phase 2, phase 3 and phase 4, depending upon the various symptoms the patient starts showing during his lifespan. So, in the lifespan, the patient starts showing the various symptoms, like there are bruises which occur, then there is hemorrhagic manifestation which occur. These hemorrhagic manifestations subsequently goes on to form the severe bleeding which occurs. Then there is increased vascular permeability which causes rising hematocrit. Then there is severe effusion which occurs, and likewise there are different symptoms which occurs, like thrombocytopenia which occurs, and according to these symptoms the patients or this disease condition have been divided into 4 major classes. So, the dengue hemorrhagic fever is further graded into 4 major stages depending upon the severity of these particular symptoms. Under these phases, the phase 1, phase 2, phase 3 and phase 4, phase 3 and phase 4 are the most severe kind of dengue infections in which the patient goes into, and this is many a times referred as the dengue shock syndrome. So, this 3rd and the 4th phase compromises of the dengue shock syndrome, in which it's very essential to recognize this viruses, because this virus have caused a number of severe bleeding within our body. So, there is number of internal bleedings which are reported. The patient goes into a coma state because there is a very low amount of blood which is present in them. The platelet level decreases down, and subsequently because of joint pains and other symptoms, the patient suffers from number of subsequent problems. Now, if we see, the dengue shock syndrome has got number of syndromes which are present. The first one is the rapid and weak pulse. So, there can be a rapid and weak pulse which will be there. Then there will be a narrow pulse pressure which is less than 20 mm of Hg. Then there is hypotension, cold and clammy skin, restlessness. So, all these syndromes come under the dengue shock syndrome condition. Now, what are the diagnostic kits or the laboratory diagnosis which are available for the detection of these dengue viruses at the very early level? So, the laboratory diagnosis methods generally confirm these dengue viruses by the detection of the viruses, whether the virus is present, whether the virus nucleic acid are present, or whether the antigens or the antibodies against these viruses have been found in the blood circulation. So, after the onset of the illness, the viruses can be detected in the serum or the blood or circulation from 4 to 5 days. So, all these laboratory tests compromises of the detection things. Now, the laboratory tests have been classified into 2 major broad categories. The first one is called as the direct method, the second one is called as the indirect method. Under the direct method, there comes the virus isolation. So, we can isolate the virus and characterize the virus. The second one comes is the genome detection, and the third one is the NS1 protein detection. So, all these comes under the direct methods which can confirm us that yes, the patient is suffering from the dengue infection, while the indirect methods consist of the serological detection of the IgM and IgG antibodies which are produced in reference to the dengue infection. So, as soon as the dengue virus infect us, these particular antibodies start getting secreted within our blood circulation, and as I showed you, during the primary and the secondary infection of these viruses, the IgG and the IgM antibodies are secreted within our blood circulation. So, if we can detect this IgG and IgM antibodies, we can easily find out that yes, the patient is suffering from dengue viruses, because these antibodies are now found in a high level and at a proper titer within our blood circulation. So, these comes under the indirect method, while the direct method is the isolation of the viruses, the detection of the virus genome and the detection of the NS1. So these direct methods are a little bit costly, while the indirect methods are much more convenient and are very cheap or low cost additions are available in the market. So if we see the table over here, we can see how these different methods are different from each other. So there are indirect methods and there are direct methods. Under the direct method, the viral isolation comes up, then there is nucleic acid detection and the antigen detection comes up. So all these are the direct method which are confirmatory tests, and the time of collection after the onset of the symptoms depend upon 1 to 5 days. But the only disadvantage of these methods is they are costly in nature. While the indirect method over here I have shown is the IgM and the IgG ELISA, which is enzyme linked immunosorbent assay, which is there. So these methods can detect the virus and antibodies which are circulating within our body after 5 days of the onset of the symptoms. So they can act as a confirmatory method, but the only advantage of using them is they are readily available, they are convenient for use, and the prices are very low costing if we compare them with the direct methods such as the virus isolation or the characterization of the virus genome, what exactly the virus serotype is present within the patient, and finally the NS1 antigen isolation. So all these indirect methods are pretty cheap and they are conveniently used or routinely used during these virus infection detection. Now if we see the image over here, the first method I have shown is the indirect method, which is called as the MAC ELISA, which means the IgM antibody capture enzyme linked immunosorbent assay. So what happens in this method is there is a microtiter plate. Onto this microtiter plate the anti-mu chain is attached to it. Onto this anti-mu chain the patient's IgM is taken out. So the patient's serum is taken up and it is incubated onto this microplate. So if the patient has got IgM which is specific against these dengue viruses, it will attach to those microtiter plates, and subsequently what happens that the Den antigen is loaded onto this microtiter plate. So as the Den antigen is loaded onto the microtiter plate, it will go and attach to the dengue specific IgM antibodies, while it will not attach itself to the dengue non-specific IgM antibody. So if the patient is having the IgM which is specific against dengue, so these antigens will go and attach to them. Subsequently on the top of these antigens another solution is added which contains the anti-dengue antibody conjugated with enzymes. So these are then added onto the solution, and as the name suggests, these are against the dengue antibodies and they are conjugated with an enzyme. So this enzyme, basically what this enzyme does, it converts the non-colored substrate into a colored product. So this colored product can easily be detected with the help of the spectrophotometer. So this is the first ELISA kit test which is readily available in the market at a very low cost price. So if we see over here the rapid dip test which is present, or the ELISA test which is present. So if we see that this is a very easy to do test in which the blood sample from the patient is taken and it is loaded at the column which is present, and subsequently the assay dilutants are added onto the sample well, and we just have to wait for 20 minutes so that the ELISA reaction start taking place. And if the patient is not suffering from the dengue infection, there won't be any line, so there will be a negative which will be there, and in the case of positive we can see that there is two lines. One, the red line is the control line while the black line is the test line. So if there is a presence of test line which shows that the patient is suffering from the dengue virus. So this is a ELISA kit which is available in the market and which the clinic people generally use for detecting the dengue virus infection within the patient who reports to them. Now what are the preventive measures of controlling these vectors of dengue. So many of these preventive measures, all of us know that the desert coolers should be covered, so there should not be any stagnant water into them. The water storage pots should be covered. The unused tires are the places where the stagnant water gets accumulated and these vectors start developing or breeding in those areas. Then there are open overhead tanks which should be covered. Then there are water reservoirs, the open water reservoirs which contain stagnant water into which these mosquito breeds and subsequently from the larval and the pupal stages are formed. Then there are construction sites where there is huge amount of water which gets stagnated. Then there are multi-story buildings, coolers of the multi-story buildings, suburban slums. So all these are the factors which help in the transmission and which helps in the breeding, acts as a breeding ground for the mosquitoes of this particular infection. So if we see the picture over here, we can easily see in the stagnant water how these mosquito larvae are starting developing in this stagnant water. So all these stagnant water should be removed from your locality so as to remove the dengue infection. Now the various prevention and the control measures for the dengue infection is the spraying of proper insecticide to kill these vectors or the mosquitoes. Then the bed nets are available in the market which can be used during the day and the night time, and subsequently we should clean the area around our surrounding so that there is no stagnated water or any kind of contamination which is occurring over there which makes these mosquito breeds over there. Now this dengue virus infection has got number of symptoms which are very similar to the chikungunya virus infection also, but the only difference is there is number of symptoms which are very different in the chikungunya, and the percentage of these symptoms differ between both these virus infection, but many a times they are misdiagnosed as if the same virus, such as the dengue virus is misdiagnosed as the chikungunya and the chikungunya is misdiagnosed as the dengue infection. So if we see the percentage of the various symptoms which are there, so the vomiting in the case of dengue hemorrhagic fever is 57%, while in the chikungunya it's 59%. So there is abdominal pain in the dengue which is 50%, while in the chikungunya fever it is 31%. Then there is conjunctival infection which is 32% in the case of dengue virus, while in the case of chikungunya it's 55%. Then there are rashes which occurs in the dengue which is about 12.1%, but in the chikungunya it's very high, severe, which is 59.4%. Then there are pains, joint pains which occurs in both the cases, but in the case of chikungunya the joint pain is much more severe than the dengue virus infection. So we come into the next vector-borne diseases over here, which is called as the chikungunya. So the chikungunya is another mosquito-borne viral disease which was first described in the year 1952 in southern Tanzania, and this is also a RNA virus that belong to a different genus which is alpha virus, and the name chikungunya is derived from a word in the Kimakonde language which means to become contorted, because there is a huge amount of joint pain which occurs to the patient. That's why the name chikungunya have been derived from the Kimakonde language which means to become contorted. Now the chikungunya virus infection is transmitted to humans by the infected mosquitoes. So the two major symptoms of chikungunya is fever and severe joint pains which occurs, along with then there is muscle pain, headache, nausea, fatigueness and the rashes. And the joint pain can be very severe and can vary in durations. Now the disease shares many of the clinical signs, as I told you, with the dengue, and many a times it is misdiagnosed in the area where dengue is very common. There is no cure for the disease and treatment is focused on relieving these symptoms. So the chikungunya is another vector-borne disease which is spreading throughout the world. So if we see the epidemiology of this chikungunya, we can see the chikungunya cases have been reported in most of the parts of the world, measuring from the subcontinents, Indian subcontinent, Southeast Asia, some parts of America. Then there are African countries from which the chikungunya cases have been reported. So the chikungunya virus is also transmitting very rapidly throughout the world. So this is also one of the emerging diseases which is of vector-borne disease type. Now, if we see the distribution of chikungunya in the Indian states in the year 2013, we can see that the chikungunya cases have been divided or have been reported throughout the states in India. The major states from which the chikungunya cases have been reported is the Karnataka, which reports about 5,295. Apart from chikungunya, this state also reports a large amount of cases of dengue also. Then comes the Andhra Pradesh, which reports about 4,827 cases. Then comes the Gujarat, which reports 2,890 cases. Then comes the Maharashtra, which reports 1,432 cases. Goa, which reports about 1,049 cases. Assam, which reports about 742 cases. So if we see the distribution of chikungunya cases in Indian states in the year 2013, we can see that most of the states have reported the chikungunya cases, and over the years these cases are increasing day by day. So this virus is also becoming a very emerging disease virus throughout the continents, especially in the African, Asian, European and the Indian and the Pacific Ocean. So this virus is also spreading. In the late 2013, the first transmission of chikungunya virus in the Americas was identified in the Caribbean countries and its territories. The local transmission means that the mosquitoes in that area have been affected with the virus and spreading it to the people. So till now, the local transmission have been identified in 44 countries or territories throughout the America, with more than 1.2 million suspected and reported cases throughout the American subcontinent. So we can just see that how this chikungunya virus is also spreading and emerging as one of the major dreadful diseases. Now, if we see the transmission of this viruses, how this virus transmission takes place, the chikungunya virus is also spread out by the mosquitoes Aedes aegypti and Aedes albopictus, which are the mosquitoes which are responsible for the spread of the dengue viruses also. So these mosquitoes generally bite during the daytime, and the chikungunya virus is then spread from one person to the other person with the help of the bite of these mosquitoes which have got infected with these viruses into them. Now, the symptoms of this chikungunya viruses generally develops about 3 to 7 days after the being bitten by an infected mosquito. The most common symptoms of chikungunya is the fever, joint pain. Along with this fever and joint pain, the other symptoms are the headache, muscle pain, joint swelling or the rashes. And chikungunya generally don't result in death, but the symptoms can be severe and disabling. So the chikungunya doesn't result in death as in the case of dengue, where the dengue hemorrhagic fever can become severe and the patient may die because of dengue virus infection, because of severe bleeding within its body or the hemorrhagic bleeding within his her body, and subsequently the various organs get affected because of these dengue viruses. While in the case of chikungunya, very less amount of patients die because of chikungunya, but the severity of this chikungunya virus infection may be very long span also. So a patient may become healthy after 1 month, or it may have the joint pains because of chikungunya virus infection for about 1 or 2 years also. So there is different severity and the different relocation of these viruses within the various patients. So most of the patients feel better within a week of this infection, and the main symptoms, main precautions which the doctor tells the patient if he or she have been detected with the chikungunya is to take proper rest so that the virus can be dislodged from the body, take lots of fluid so that these virus can be eliminated from the body, from the blood circulation. So these are the two major control mechanisms which the doctor generally refer to the patients who suffer from this particular diseases. Now, if we see this slide over here, the various symptoms of chikungunya, which are, as I told you, are the fever, severe headache, then there is joint pain, muscular aches, joint pains are also there, then there is a back pain, rashes also develop. So, if we see the picture on the right hand side of the screen, we can see that the joints, the finger joints of that lady have become crippled because of the chikungunya infections, and there is severe pain which occurs on the leg, and the leg have got swollen up because of the swelling, and there is acute joint pain which occurs at the joint regions. Now, if we come to the virus structure, the virus contains a glycoprotein which helps in the cell fusion with the infected cells, and subsequently these glycoproteins binds to the cellular receptors which are present on the cell into which they enters. So, this virus are more or less similar like the dengue viruses and contains a RNA genome. So, if we see the structure over here, these viruses gets attached to the cell on which they gets infected with the help of their glycoprotein and the receptors which are present on the top of the cell. So, with the help of these receptor, the receptor mediated endocytosis occur, and these viruses are engulfed within the cell in which they have infected. So, within that cell, the RNA of these viruses are released, and subsequently they are transcribed and translated so that the nucleoprotein core assembly and the other glycoproteins can be synthesized and produced, and a number of daughter cells are then blebbed out in the form of budding particles from that particular cell. So, it all started with the infection, and subsequently the mature virions get released from the cell. So, we can see that how these viruses are developing within these infected cells. Now, the chikungunya is preventable but not treatable. So, there are various preventable measures which are there. First is the use of air conditions or the windows or the door screens which can be done. Then the person can start using the mosquito repellents on the export screens. Then there are different repellents containing DEET, then there is piacardin, then some lemon eucalyptus oils are present which acts as a repellent. Then it is generally suggested that the person should wear long sleeve shirts and pants, and the standing water at the outdoor containers should be avoided. So, all these are the preventable measures how these vectors can be dislodged from their breeding grounds. So, it is very essential to stop the breeding of these vectors or the Aedes aegypti or the Aedes albopictus at your near vicinity. Now, if we see the main strategies for the mosquito control, so the main strategies for the mosquito control is the prevention of the mosquito breeding. The first one is the prevention of the mosquito breeding. Under this one comes is the indoor residual spraying, or which is called as the IRS. So, in the IRS what the people does is, we can see that the personals are having a residual sprayer. Into this residual sprayer, the various insecticide or the sprayers are present which are in the form of malathion, which is the generally recommended indoor residual spray as per the policy of Government of India. So, these sprayers, into these sprayers these solutions are added, and subsequently they are diluted to make the exact concentration, and then these personnel goes into the places where there is chances that the mosquito will hide or start breeding up. So, at these particular places the sprays are being done so that the mosquito which is hiding or breeding at the closed localities or closed chambers or stagnant water, these spray can go and kill the larvae or the pupa of these mosquitoes, and subsequently they can get killed. Now, the other main strategies for the mosquito control is the protection of the mosquito bites, which are the use of mosquito repellents. The most common one is the use of the mosquito repellents, which are commercially available in the markets. Then there are it is generally recommended that the person should wear long pants and long sleeve shirts. Then there are use of window screens which are there, and finally there are mosquito bed nets which are present. Now, these bed nets are of different types. So, there are different bed nets which are present in the market. The first one, bed nets, are the traditional bed nets which are present, which are normal bed nets we generally use at our home. The second bed nets is the insecticidal treated bed nets, and these, as the name is suggesting, insecticidal treated bed nets means these bed nets are treated with insecticide. So, in the insecticide solution, these bed nets are dipped, and subsequently the dipped insecticide bed nets are then dried in the sunlight, so that the bed nets can be dried, and these insecticide impregnated bed nets can be subsequently used for the mosquito control measures. And finally, the third type of bed nets which comes, they are called as the long-lasting insecticidal bed nets. And these long-lasting insecticidal bed nets, as the name suggests, they last for a longer period of time. For example, they last for 3 to 5 years without any retreatment. So, these bed nets are also impregnated with insecticide, but these long-lasting insecticide bed nets are much more advanced than the insecticidal bed nets, and these bed nets can be used for 3 to 5 years without any reuse, without any resolutioning of these bed nets. So, now the government of India has helped us, the various medical facilities, to come up with these bed nets, and it is distributing in most of the parts of the rural parts of our country free of cost. So, there are different long lasting bed nets which are available in the market, like the Prima net, Oyster, like this one, which are available in the market, and the government of India are giving them free of cost to the people, rural people of India, through the medical center. So, with this note, I end my lecture over here on dengue and chikungunya, and subsequently I will cover up in the next part of the lecture the various vector-borne diseases and the mosquito-borne diseases. Thank you very much. And
thank you, sir. Thank you so very much for giving once again a very productive session. Dear friends, if you want to give your feedback regarding this particular lecture, then you can mail us at info.cc@nic.in, or if you want to ask some questions regarding this particular lecture, then also you can mail us at info.cc@nic.in. We would be meeting again, as Dr. Amit Bhattacharya himself said, and would be discussing more on this topic. With this note, thank you, sir. Thank you so very much.
Thank you very much.